It's very different going from no implant to any implant, right? You're going to have that dramatic result no matter what. But if you already have implants and then you're more or less, like you said, changing to the same, again, you're not going to see those differences, right?
That's a
And
good way to
you
put
just
it.
your breast tissue is stretched out already from the previous implant.
Breast surgery Q&A, implants, techniques, and what really works. I'm Dr. Ashley Amalfi, board certified plastic surgeon, and welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery. I'm here with board certified plastic surgeon Dr. Smita Ramanathan, and today we are answering your questions, guys. So we have been doing lipstick and lipo since 2020. We have so many Q&As, and so we are breaking down implants into two parts and answering all of your questions. Welcome, Smita. Let's get it going, girl.
I know we have so many good questions, so I'm really excited to do this episode. So we're going to just go through them and
Sure.
give you our honest answers.
Okay.
Okay, so the most natural results I see are dual plane implants. I don't really understand how this works. Is it two small separate implants or
Just
question mark? Interesting.
cool. That's
Yes.
interesting.
Um,
I mean, I guess
yeah.
the dual is kind of confusing, guys, right? And then like Kylie Jenner has been talking about her implants, which she called half under the muscle. So that's the same thing as a dual plane. So that means that a little bit of your muscle is cut so that your muscle retracts up a little bit. And the dual plane means that the implant is below your muscle on the top part, but there's no muscle on the bottom part because it's been cut. So down here, there's no muscle. So it's just below breast tissue. So it means that the plane is a little bit different at the different parts of the implant, but it's one implant. It's just the
Mhm.
coverage is different in two different places. Um, what do you think about them saying that this is the most natural? What do you think?
I mean, I'm a little biased toward this. It really depends, right? I mean, I think at the end of the day, historically, that
Yeah.
was the answer, right? It was more natural because the implant was under the muscle kind of pushed on the upper part of that implant to give you that natural slope. And then the bottom that's not covered kind of fills in your breast tissue
Hmm.
to give you that fullness. But I think now we have such great technology. We have such great implants on the market where you can still, as long as you have some breast tissue, you can still have your implant above the muscle, under the fascia, under the gland, and still have really natural
Yeah.
results. So,
I think that's the
um,
key. That's the
right?
key, you guys. Like stuff is like come a long way. And a lot of times you'll see people saying, okay, this is the best, this has the lowest complication rate. But a lot of that data is super old. And it's when we only had like a few implants to choose from. And now there is so much technology. I mean, even in 10, the 10 plus years that we've been in practice, everything is different. Everything that we do is totally different than the way it was done when we trained. And I think that's the key to finding like a good plastic surgeon who's going to give you realistic results is that they're constantly learning and evolving and changing with the technology. Like you don't want someone who's like, "Oh, this is the only way to do it because that's how I trained to do it 25 years ago." That's old fashioned. Like so
Fashion.
you can do new things because we have new technology. It also doesn't mean that the original ways that we did it are bad because I think in some people that's still really good too. So dual plane can be really natural and there's other things that can be really natural too. And so
Yeah.
I don't think that there's a one size fits all. And there's also no such thing as a patient where we use two implants. That's not a thing.
I mean, one on each side, so you get
Yeah.
two, but not one,
Yes.
uh, two
But
in each breast.
it's an interesting little question. So thank you. I'm looking at our next question, and this
Yep.
is a patient like who's specifically asking about her implants. So she says, I have 530 cc's high profile extra. That's a big implant. And they look smaller than my moderate 525s. So there's only 5 cc difference. I have no cleavage. The projection is no different than my moderate. I'm not happy. I wish I understood this better. So essentially, she went up by 5 cc's and went from a moderate to a high, and she feels like nothing has really changed.
Yeah. Well, I mean, so yeah, I mean, I think that's understandable and expected, right? When it's under the breast, you really don't see anything less than like what, 40, 50 cc's, right?
Yeah,
Anything less than that is so minor that when it's under the breast tissue or under the muscle or under the fascia, you're not seeing those changes.
yeah.
And when you're from a moderate, so 5 cc's is not going to be noticeable,
That's nothing,
period.
guys. That's like crying some tears. Yeah, that's like literally there is no volume. That is no volume.
There's no volume. Then
That's
going from a moderate to a high profile is also not that much of a difference, right? When you actually compare the implants, we're talking about a couple of millimeters more in
yes,
projection from the high to
literally.
the moderate.
Yeah.
So you're not really going to see any differences, unfortunately.
When you said like 40, 50 cc's, I will tell people like if they want to switch out their implants, I usually will say I'm not going to do it unless we're changing by 100 because
Yeah.
these little increments, you guys, are so tiny that they don't matter. So, and sometimes when we're trying to figure out what, your next implant is going to be, like on the doctor side, we have these like complex charts that have numbers and graphs and stuff like that. And sometimes, even though it's like a lot of numbers, I'll show people that and be like, look at this. Like, this is your implant. And like, if we're going to move to this, it's only a millimeter wider and 2 millimeters more projection. And that's equal to nothing. And so I think that sometimes we get so caught up in numbers that we sort of forget that these are very minute changes and you need to
Mhm.
make bigger changes in your implant if you want to see bigger changes in the result. Um,
Mhm.
and
Exactly.
yeah, I think that's, I guess, the messaging I would say.
Yeah, and I would also say too, it's very different going from no implant to any implant, right? You're going to have that dramatic result no matter what.
Right.
But if you already have implants and then you're more or less, like you said, changing to the same, again, you're not going to see those differences, right?
Mhm. That's a
And
good way to
you
put
just your breast tissue is stretched out already from the previous implant. So, um, going from the high profile or moderate I mean, just changing profiles alone is not going to be noticeable,
it. Yeah.
even though they might sound nicer. But again, don't get caught up in the numbers.
Yeah. Agree. All right. What's next?
All right, next
This is
question.
kind of fun. I also kind of
I
like that I don't
too.
I also like
Right.
that I don't know what you're gonna ask me.
I know we're thinking on our feet today. Okay. I had a breast reduction 19 years ago and an implant 6 years ago. My surgeon went way too big and didn't do anything like what I asked. He also suggested a teardrop. It falls into an unnaturally elongated breast. I'm editing this a little bit. Um, and it can be put in it looks a little crooked,
Hmm.
which I think mine is. Do you think that this can occur commonly with a teardrop implant?
There's a lot to unpack there.
There's
So,
a lot to unpack. Okay, so she had a breast reduction
yeah, and
probably
that
when she was younger, went
Mhm.
through life probably, right? And ended up losing volume and needed the volume replaced with an implant. Had a teardrop, which typically those are textured implants, and essentially does not like the teardrop appearance, right? I mean,
so
that's more or less.
yeah. So let's break that into two parts. The first is that um it's not uncommon for people to have reductions and for the reduction either initially to feel a little too extreme or for years to go by, like 15 years in this case, and you have, life changes and pregnancies and breastfeeding and postpartum, and then your breasts might look different and you might end up smaller than you wanted. So you can either end up smaller than you wanted or evolve to be smaller than you wanted. I do see people like this who want implants and like I get really nervous to do this and I very much under promise a good result because the way I explain it to people is like when you do a breast reduction, they've cut every which way in your breast and it's full of scar tissue. And now I'm going to
Mm,
put an implant in there and I'm going to expect an implant to drop and fill out your breast in a very predictable way. But when it's full of spider webs of scar tissue, it can't settle in a predictable way. And so I think it's hard to get a home run putting an implant in a patient who already had a lift or a reduction, because the predictability that we're so used to in plastic surgery of that final result is not there. And so I I will really underpromise our ability to get it perfect, because the technique is, probably better done in the opposite order. I don't know if you have anything else to say about that, or you want to talk about teardrops.
Yeah. No, I mean, I think it's setting those expectations, right? Like you set those expectations early on. Um, Listen, anytime we're reoperating on a breast, a reduction is a perfect example, but even a lift or a previous implant, it's always going to be a little bit more unpredictable than if it's a fresh, never operated on, no scar tissue. So just having those expectations can really sort of set you up for success
Yeah.
afterwards. But
Hard to knock that
yes.
one out of the park, guys. And then, you know, uh, let's talk a little bit about teardrop implants. I don't use them. I used them in my training, 15 years ago, but teardrop implants are shaped implants. That's what this patient is talking about. So the
Yeah.
implant, no matter what you do with it, it's always a shape. It's not a shape in certain positions. It's a teardrop
Mhm.
in all positions. And it has texturing on the surface so that it kind of sticks in your body like Velcro, so that the teardrop shape is sitting the right way. Because if it flips upside down or sideways, that looks weird. And it sounds like that's maybe what this patient is experiencing, is that it didn't stick in place, probably because of all that scar tissue. And it might look a
Mhm.
little wonky, which I've definitely seen, right?
Yeah, no, it definitely happens, and I think that's probably why neither one of us uses,
Yeah.
shaped implants in our practices or texture for that matter.
Yes.
Uh, and again, this kind of goes back to our first question where the technology is so much better that there's so many great alternatives to get you that natural appearance with the softness, the
Yeah.
slope at the top, fullness at the bottom. But, in situations like this, I always encourage you to go back, talk to your plastic surgeon, and kind of they should be able to explain all of this to you based on your anatomy, what they saw in the operating room, specifically what implant they used. You should feel comfortable having those conversations with them so that they can, you know, really kind of dive deep into your personal situation.
Yeah.
But
Discuss the
again,
options, you guys. I mean, there's
yeah.
lots of things to do from here. Like, it's not a lost cause, but you have to talk to your doc about what they're comfortable with, what their experience is, and see how you can go from there to just
Yeah.
improve upon your outcome. This is fun.
Yeah.
I think we
I
should
know.
wrap
I
this
like
part. We have so many questions. So we're gonna do another part here, you guys. So make sure that you follow, that you subscribe, and that you like us. And I mean, I hope you like us. And and then
it. Yes,
we're
come on.
we're gonna break it up. And so we'll come back and answer a few more questions, because there's a bunch here, and I think they're all good, and they all have all these, like, we're getting really in the nitty gritty, and I love it. So tune in, follow along. We'll see you next week, and we'll just keep going down the list, literally, you guys, of your YouTube questions. So follow along. We'll see you next week.
All right. See you soon.
Bye, guys.